about Rose, so you know she has a master's degree in Christian counseling. She is a licensed drug alcohol counselor, and since 1995 or something around there, she has led our program there. She's also been married for 51 years. And so she has some credentials about this, and next session we will have her talking to us. Thank you.
As you know, I'm Rose. I'm going to talk about assessing addictions, and this is very important when you get somebody coming in and you really don't know where they're at in the addiction process. Do you have swimming pools here?
Yes.
Okay. I liken addiction to a swimming pool. You know, you can jump in that 3-foot end and you can have a lot of fun there, but it's boring, right? So then you mosey on down to the 5-foot, and it's a little more interesting there, but eventually that's boring. And then all of a sudden you're in the 10-foot, but you can't swim. And now you're at the bottom of the swimming pool. And it's going to take somebody bigger than you to get you out of there. And so I use that a lot of times, and I ask them, where are you at in the swimming pool? And it's really amazing how they can kind of place themselves in that swimming pool. So that's just a little something extra I throw in here. 1/7 to 1/10 of substance abusers are properly identified, because most of them that come to our program really do not see where they're at in the addiction process. So, of course, when we hear from them, they don't have a problem. But then after we begin to assess them, we need to see exactly where they're at so we know where to put them in the program. We use several different assessment tools. One is the DSM-5. It's a diagnostic and statistical manual of mental disorders. And it's put together by the American Psychiatric Association. We use that one, and then we use the SASI, which is the Substance Abuse Subtle Screening Inventory. Then we use the KCPC, which is the Kansas Client Placement Criteria. And I know when I first had to learn all this, I thought, really? But it's very valuable, the information that we get to see exactly where this person's at in the addiction process. The faith ladder can also be used, and dealing with spiritual growth. And I'll get into each one of these. Both the psychological and the physical aspect of addictions need to be dealt with. Denial is really a big problem when people first come in. In our program, most of the people we get are court ordered to come into treatment. They really don't want to be here. And most of them don't really have a problem. But the longer they're there, the more they realize, yes, I do have a problem. So a lot of them really don't know themselves where they're at in the addiction process, and they underestimate where they are at. But we, as counselors, need to know where they're at to put them in the right treatment. Substance abuse is a choice. And when a person is addicted, they must have intervention. Recovery is affected by their environment. As we just said, you know, once they go through treatment, they go back into this home. That environment is affecting that person. So, and on that note that we were just talking about, when we get teenagers in our program, we do set up at least 4 sessions with the parents while that teenager is going through the program. It's very important. Faith to recover, absolutely, they need faith. And then they need to be willing to recover. We use the cage methods at times. It's very, very short and answered with 4 questions. Have you ever tried to cut down on drinking or thought you ought to? Has anyone criticized you for your drinking? Have you ever felt guilty about your drinking? Have you ever drank to get rid of a hangover or to steady your nerves? Those questions give us a lot of information as to where this person is at. We rely on the DSM-5 criteria. And this has just recently been changed, so I may have to call on Dr. Reiner for a couple of questions here. This gives us the evidence of where they're at in their use. Are they mildly, is their problem a mild problem with the addiction? Or is it a moderate problem? Or is it a very severe problem? We figure out where to place them here by the questions we ask them. And the questions we ask, let me see if there's still any other, 11 questions. The first one, do you take larger amounts over a longer period of time than you intended? And those are yes or no questions. Do you have a persistent desire or unsuccessful effort to cut down or control use? Do you spend a lot of time to obtain the substance and recover from its effects? Craving or a strong desire or urge to use alcohol? Do you have cravings? You had a reoccurring alcohol use resulting in a failure to fulfill major roles or obligations at work, school, or home. Do you continue to use despite the fact that you have a social or interpersonal problem caused or exasperated by the effects? And a lot of times I get to break that down and speak in their language. Do you miss important social or occupational or recreational activities because of your use? Do you have a reoccurring alcohol use in which it is physically hazardous? Is alcohol use continued despite the knowledge that you have a persistent or reoccurring physical or psychological problems caused or exasperated? Is there tolerance as evidenced by increased amount to achieve the same amount of intoxication? Or do you have a diminished effect when you're using? People in the last stages of alcoholism don't have to drink very much, and they are intoxicated. Withdrawal as evidenced by standard symptoms or a related substance is taken to avoid symptoms. Then we have what is called the SASSY. It is substance abuse subtle screening inventory. This deals with the psychological dependence. They come in, they're physically dependent, they're psychologically dependent, and they're spiritually dependent. So this deals with the psychological dependence. The person who developed this asked 1,000 questions to addicts and non-addicts, and they came up with these defensive scales. It is really about a 93% reliable method, and this tells us whether they are addicted or whether they are simply abusing the substance. We rely on this SASSY heavily to see where we need to place them. The FVA is called the face value of alcohol. These are questions that they're asked about their alcohol use. They're really direct questions, like, have you had drinks with lunch? How many times have you had drinks with lunch? So they're very direct questions about alcohol. And then the FVOD is the face value of other drugs. That has to do with their drug use. Again, very direct questions. The rest of these questions are very subtle. The OAT differentiates honest abusers from non-abusers. One of the questions on here would be, do you believe people lie to get what they want? And like they're subtle questions. And they would write to, it's true true and false questions, okay? The subtle SAT is the subtle screening items more resistive to failing. DEF, the general testing advancements. These questions have to do with how defensive they are. SAM identifies dependence and defensiveness, and FAM has to do more with the family issues, codependent questions. COR, risk of criminality, and that, in other words, do they have a high risk? Do they have a lot of criminal activity in the past? RAP, to detect if the answers are not related to the test. The RAP is really tells us if they've been honest in answering the questions. I brought one of those with me. I'll show you what it looks like. These are the subtle questions that they're asking. So then they fill out these little boxes here. And then these are the questions asked about their alcohol use and about their drug use. So we take that and then we score that on this sheet. And from this sheet, we put those answers here, and we determine whether they have a high probability of a substance dependence or a low probability. So that's the SASE. Then we have the Kansas Client Placement Criteria for treatment placement. And it is based on the American Association of Addictive Medicine. There's 6 dimensions in this Kansas Placement Criteria. It has about 6 sheets, and each sheet has a dimension of questions that we ask. And what happens here, these dimensions will, first of all, deal with acute intoxication, withdrawal potential, current use, past alcohol use of drugs and alcohol, and is there a history of withdrawal? They answer those questions for us. And then the next one deals with the medical conditions, their physical condition, their health in general, or all for women who want to know if they're pregnant, because that is very important for fetal alcohol. Then the emotional behavior conditions, their mental status, risk of harm, abuse potential, is there any mental disorders, are there mental disorders in the family, emotional and behavioral complications of the addiction, and then the treatment acceptance. Is there a lot of resistance here? What are they coming on their own? Is there a lot of denial? And then we look at the relapse potential. Do they have the ability to maintain abstinence? Have they had a failure at a lower level of care? Have they been in treatment before? Did they complete treatment? Are they in any meetings right now? And then the recovery environment. We want to look at the family, the social support system, their job, their legal involvement, and do they have a way of coming to treatment? This all helps us to determine what level of treatment to put our clients in. And there are different levels. Sometimes we get people who have maybe just used periodically and have gotten a DUI, and we will send them to an 8-hour education program because they really do not fit an outpatient program. Sometimes that happens. Then the level of treatment that we deal with at our clinic is the outpatient treatment. We have clients come to treatment 12 weeks. They attend twice a week, once a week to group therapy, once a week to an addiction meeting. And then they come for 6 weeks of aftercare, attending 1 meeting a week for aftercare. We find that the 12 weeks for outpatient is really sufficient. And then the aftercare as well helps them to get acclimated to leaving the program and getting out there on their own. Intensive outpatient or day treatment. This would be an outpatient treatment program where they're coming 3 to 5 times a week instead of just 2. We have medically monitored inpatient treatment and then the medically managed inpatient. This would be the acute people who are under hospital care. So we want to look at where they're at spiritually as well. And this is based on the fact that they will recover and the willingness to do whatever it takes. We have to have the will, we have to have the want to recover, or we're not going to recover. And it is God who works in us the will to do his good pleasure. So many times they'll say, I really like what I'm using. I don't want to recover. But I know I have to, so I will have them just pray. God, working me the will, give me the want to recover. We need to know what where they're at in their spirit. Do you believe God can heal you? Do you believe God's going to heal you? Or when do you think God's going to heal you? When you're 85, 70, 60, 6 months from now, or 1 month from now? Are you completely delivered now? Will you still be sober 1 month from now, 1 year, 20 years? And a lot of people fear relapse. Even as they're going through the program, they fear relapse. So we deal with those fear issues. The spiritual growth assessment is based on 2 Peter 1:5, but also for this very reason, giving all diligence, add to your faith virtue, to virtue knowledge, to knowledge self-control, to self-control perseverance, to perseverance godliness, to godliness brotherly kindness, and to brotherly kindness love. It's really fun to watch the clients go through the 12 steps because you can see them, come from one of these, self-control, and then into perseverance, then to godliness, and by the time they're finished, brotherly love. And when they learn to love themselves because God loves them, and when they know God loves them, they can love themselves, then they can love others. That's one thing we want to really help them find is the God of love for them. So the critical step is step 4, which deals with self-control. Is the client saved? If they don't make that commitment to Christ in step 3, they have a problem with the rest of the program. You have to add Jesus into your heart and life in order to follow the spiritual principles that are laid out before you. So some of them do have a problem with that, very few, but we help them try to get over that into step. That's pretty much what I have for our assessment. These tools are really valuable because they do help us determine what level of